A visit to the dentist is not one that many people dread. Not just because of the cost, but because of the many horror stories that men experience in the hands of dentists. George Mugendi always dreaded a visit to the dentist, and the only reason he's here today is because he can't bear the pain. Otherwise, he was willing to endure.
Every time I thought about the dentist, I just thought about the pain. Yeah, and so I've just been putting it off, but then I realized that the longer I put it off, the worse it gets for me.
A look at the scan reveals George's teeth need some TLC, especially his front teeth. Ready to face his fears, George is sanitized.
We don't want our patient to get an infection, so we must clean the face, and when we do this, we kill as many microorganisms as we can.
But as Dr. Gakonyo tells us, there are various options of replacing a broken tooth.
We can give him a tooth that he shall be removing at night. We can have another way of replacing that tooth that we can attach it on the remaining teeth.
But who qualifies for this kind of an implant?
We avoid placing implants in patients who are heavy smokers. We also are careful with patients who are diabetic. However, it is not an absolute contraindication to have implants done.
Back to the procedure, and Dr. Gakonyo, who has been carrying out dental implants since 2011, cuts into George's gum to assess the state of the jawbone as projected on the X-ray. And it's not a pretty sight, though George, who is on local anesthesia, appears to feel no pain.
Is there any pain there?
After the procedure, the doctor stitches together the gum, marking an end to the constant pain.
Without fighting with the tooth, there we go, nicely and out.
Or so you thought. However, the moment George has been dreading comes when the dentist's drill is put to use.
Now, on the surface of that implant,
this is important since the implant has to match the old tooth. And now the first stage, which is the surgical phase, is done. The stitches are expected to automatically fall off after a period of 3 to 4 months. But should there be a need to see the dentist again, George is covered.
Having done this, we shall wait. You also see there is pus, around that site. You do not have to wait for your next appointment. You can actually come back earlier, then we are able to do something.
The procedure costs about 150,000, but one pays in a span of 5 months. And here is what George expects in his next visits. The replaced tooth is not so obvious as Dr. J, the head of the dental department at Lyons Hospital, tells us.
We will match color depending on the nearby teeth, and based on that we'll get a cap that is completely or as close as possible to the nearest tooth, so that someone cannot really tell from a distance.
After the procedure, I'm keen to find out whether George is still terrified of dental procedures.
I think it's been an absolutely amazing experience because the initial dentist experience were always very painful, but this was absolutely painless. It's not what I expected. It has actually exceeded my expectations. Just like the good dentist told us, brush your teeth at least 3 times a day and you will not have to see a dentist. Grace Kuria, K24, for your health.